Hello, my name is Ace Beam. This poster presentation represents partial fulfillment of the requirements for dissemination of my DMP project. The title of this DMP project is Implementing a Troponin Trending Toolkit in a Rural Emergency Department to Increase Provider Adherence to Troponin Trending Guidelines. It was realized there was significant non-adherence to troponin trending guidelines among emergency department providers. 58% adherence to troponin trending guidelines was realized at the project facility. The American College of Cardiology recommends measuring cardiac biomarkers in patients with suspected myocardial infarction. The purpose of this DMP project was to improve emergency department provider adherence to evidence-based troponin trending guidelines. PICO question. Among healthcare providers in a rural emergency department, does implementing a troponin trending toolkit for patients presenting with chest pain increase provider adherence to troponin trending protocol over 1 month? Design, method, and project implementation. This project included the implementation of a toolkit consisting of a chest pain panel as well as a one-on-one educational session with emergency department providers. Pre- and post-chart audits were used to evaluate outcomes. Review of literature. Chest pain accounts for approximately 7.6 million annual visits to U.S. emergency departments. Chest pain is the second most common reason for adults to present to the emergency department. Cardiac markers are used for the diagnosis and risk stratification of patients with chest pain and suspected acute coronary syndrome. Cardiac troponin is the only biomarker recommended to be used for the diagnosis of myocardial infarction at this time due to its superior sensitivity and accuracy. Data collection. Data collection included pre-intervention chart review of 12 patients admitted to the hospital with chest pain to the emergency department, with 58% meeting the 2-hour troponin trending goal. Post-intervention included review of 9 patient charts who were admitted to the hospital, with 100% meeting the 2-hour troponin trending goal. Outcomes. Implementing the troponin trending toolkit increased provider adherence to troponin trending guidelines from 58% pre-intervention to 100% post-intervention. Conclusion. This project achieved outstanding results in the first month of data collection following the implementation of the troponin trending toolkit. The project would benefit from additional data collection for 3 months to determine long-term effectiveness. Patient outcomes will be positively impacted as a result of implementing the troponin trending toolkit. Please review project references at this QR code.